Since we have talked about the instrument grasp and transferring instruments to the dentist, let's talk a few minutes about developing our Miro skills and using a fulcrum when we become the operator. So developing these skills is vital to any operator, and since the dental assistant often works as the operator, these skills are very important to master also. So it's not easy, but with practice it is achievable. The Miro can be used for viewing the oral cavity. It can also be used to retract tissue to increase the view into the oral cavity. So depending on the arch the operator is working in, the patient should be asked to move their head to make it more visible for us to be able to use the Miro. So we should ask our patient to tip the head back so the maxillary arch can be viewed. When working on the mandibular arch, the patient will need to lower their chin down toward the chest. So once the Miro is placed in the correct position, the operating light should be used to reflect light onto the Miro to increase visibility. So with the chin tucked downward, the operator is able to get the Miro in here and view the lingual of the anterior teeth in the Miro. So they would be able to see the lingual. Very difficult to see those surfaces without a Miro. Okay, so when we use an instrument, we're using a Miro to see and to view. We also have to use a fulcrum. This is very important when you are working as the operator and in control of your dental instruments. So a fulcrum is a finger rest. So that stabilizes the hand to reduce the possibility of having the instrument to slip and damage the tissue or hurt the patient. So as you notice, we have a pen grasp. The patient, we're working here on the number 19. The operator has their two fingers stabilized on the central, the lateral, and the canine. So on 22, 23, and 24, they're stabilizing their fingers. They're working in the same arch. So they're working on the molar, number 19. The fulcrum should be established within the same arch and within the same quadrant, okay, if possible. An internal fulcrum is best when the operator can use a tooth or teeth to stabilize their hand. We never want to operate a dental instrument free-handed. We must always use a fulcrum. And this is something that will come with practice, just like using the Miro to view the oral cavity.